Here in Ireland, we have socialised medical care. That is to say, the government takes care of us, the citizenry, from cradle to grave. And let me tell you, they are making one god-awful mess of it. Yes, the HSE, as they are known, the Health Service Executive, that's what they call it, our Irish Governmental Health Service, the Health Department. It has a budget of about 22 billion a year, I believe, at current rates, and there's only 5 million of us, so you do the math. There's waiting lists, I believe, that go on for years. Something approaching 750,000 people, I think, last time I checked. I could be wrong, but last time I checked, it was up there, are waiting on some procedure. Horrendous inefficiency. Horrendous. We've been building a supposed national children's hospital for about 10 years, and the costs have gone up by about tenfold from where it started, and it's still not open. It's supposed to open years ago. Absolute and utter inefficiency. There was a case, I believe, not a couple of years ago, where they hired a radiographer from somewhere in Africa, Malawi or something like that, I think it was. Turned out when she arrived, she didn't know how to turn on the machine. Yes, I kid you not. That's a real story. All this and many, many more little trinkets of information you could find regarding the Irish health services. People in Britain think they have it bad with the NHS. Believe me, you're doing all right with that compared to what we put up with. Anyway, we have a story today, and I thought to myself, really? Yes, it seems that greyhound dogs, now I like greyhounds, they're supposed to be a very friendly breed, apart from their running prowess, which we're all familiar with. I believe they're very friendly dogs. I like greyhounds, I do. Anyway, turns out in the Irish state today, greyhounds get better state dental care than children. Who'd have thunk it? Is it true? Well, let's find out. Come on over to rollercoaster.ie. Rollercoaster.ie, yes indeed. And its byline is for the ups and downs of pregnancy and parenting. So as you can imagine, I never miss an issue of rollercoaster.ie. These are good. You should read this stuff. It's very helpful. Anyway, according to rollercoaster.ie, for the ups and downs of pregnancy. I think in this day and age, I think anybody can get pregnant. Isn't that the mantra? Isn't that what we're all supposed to say? Anybody can get pregnant. Anyway, look, this is serious stuff. Enough frippery. Enough japery. Greyhounds, says rollercoaster.ie. Greyhounds get better state dental care than children. This is from November, end of November to this year, so it's fairly recent. By roller coaster author. Persona non grata, whoever that is. Somebody hiding their light under a bushel at rollercoaster.ie. Come on, come out from the weeds. Let us know who you are. By roller coaster author. Some nameless author who writes for Roller Coaster.
This is pretty much the worst video ever made.
Greyhounds, according to Roller Coaster author, greyhounds are getting better dental treatment from the state than children. The head of the group representing the country's dentists has said, Fintan Horahan said it's, quote, beyond a joke that the government has admitted that greyhounds are entitled to €50 grant to have their teeth fixed, while children are left waiting for up to 10 years in some areas for dental treatment. 10 years? You'd be grown up, you'd be an adult, you'd be married with 2 mortgages by then. Although in today's Ireland, no, you won't have mortgages. Nobody can get mortgages anymore. Those days are gone. You'd be lucky to rent a shed. The Irish Dental Association, let's go on from unnamed author at Roller Coaster. The Irish Dental Association chief said on a social media this week, quote, this week we learned that while the government may not be very interested in helping children or adults access dental care, there's an extra €50 per greyhound for any dental care needed. You just couldn't make it up. I wonder, could you rebrand a couple of your kids as, I don't know, put one of those masks on, put a mask, put a costume on them, maybe. I don't know. Would you get away with that? I'm sure somebody's tried it. I mean, this is Ireland. Mr. Hourihan was responding to a Public Accounts Committee meeting where Greyhound Racing Ireland's head vet revealed that dogs are in receipt of nearly €500,000 per annum, per year, from the Exchequer for health checks. That's no small sum for the Greyhounds. William Fitzgerald told the Dáil spending watchdog assistance comes on a number of levels. Preparing the Greyhounds to be rehomed involves a number of facets. First of these is getting a dog neutered, so he won't be propagating. A contribution of €50 per Greyhound is made towards this. There's also a contribution towards the cost of vaccinations and preparing health checks of the Greyhounds to the amount of £80 per Greyhound. Okay, I mean, it has to be done. I'm not saying it hasn't to be done. I'm just saying, where are the children? Will somebody think of the children?
Won't somebody please think of the children?
Will somebody think of the children? Since the beginning of February this year, there's an additional €50 per Greyhound for any dental work required. Mr. Hourihan described the spending on dogs' dental care when put alongside the massive waiting list for children as outrageous. And it is. The children can't get basic dental procedures. They can't get to a dentist. And the state is basically throwing them to the wolves, or throwing them to the Greyhounds. In this case, he pointed out that children are supposed to receive free dental treatment from the HSE in 2nd, 4th and 6th class while they're in primary school. But he says the reality is this is not happening, with many children now being offered just a single visit during their entire school career. And I know this is true. I know several cases where no treatment could be got. There was no options for children. None. Zero. Don't call us again. Go away. No, we're closed. There's a happy-looking girl there. She must have got a bit of work done. Anyway, let's carry on from the unnamed author at Roller Coaster. And even then, many are being forced to wait until they are in secondary school. That's, as I was saying, if at all. You'd be lucky. I think it's kind of like a lottery. Just buy a ticket and your name might come up. Mr. Hourihan told the Irish Mail on Sunday, this means that some children are not receiving an initial checkup until they're 16. And therefore missing out on vital early intervention, resulting in more drastic treatment or in worst cases extractions being required during the formative teenage and early adult years. And this is absolutely true, because children these days are eating a lot more. They have more money than we ever had. They're eating a lot more sugary things. They're drinking a lot more soft drinks. They're not exercising. They're sitting in front of computers, laptops and iPads and their phones, and they're chomping on jellies and they're chomping on sweets and they're drinking a can of Coke. So by 16 you're probably going to need a bit of work. So I think it's really, really important, especially today with today's lifestyles, to keep check on kids as they're developing, apart from the changes of adolescence and all that goes with that. There's a lot of factors. I mean, if you're not getting a checkup with a dentist till you're 16, you could be in rag order by then. I mean, you could be in bits by then. And as they're saying here, basically, you might have to pull out half your mouth. I'm aware, let's continue, I'm aware that this has happened in Laois and Offaly, to name two counties. Children were not seen until second and in some cases transition year. You're practically out in the world, working two jobs and getting married. Mr. Hourihan added that understaffing and the lack of resources in the public dental service is to blame for the huge delays. The number of public-only dentists has dropped by a quarter, 23%, in the past 15 years. That's a massive drop, decreasing from 330 in 2006 to 254 in 2022. This means the HSE needs to hire 76 dentists now just to bring the service back to 2007 levels. I told you, the HSE, byword for disaster and inefficiency and bad management. It's an absolute catastrophe. I'll tell you, put the government in charge of the Sahara Desert And in 5 years there'll be a shortage of sand. The lack of HSE dentists is also impacting on the delivery of care to other vulnerable patients, including those with special care needs and those waiting on essential public orthodontic treatment. The waiting list for treatments required general anaesthetic is 2 years long. So if you need big work done, 2 years, and I'd say it's 2 years and the rest. Dentists say they're being forced to choose which children are in the most pain and treat them ahead of those who may have already been waiting for months or years. The Irish Dental Association said this in turn is leading to high levels of stress and burnout among HSE dentists. The HSE did not respond to request for a comment. Of course they didn't. No, sorry, we're not in today. Go away. The phone's just ringing out. Don't pick up that phone. Don't pick up that phone. Yeah, that's the HSE. An absolute catastrophe, a byword for mismanagement and waste of public funds with disastrous results. You've got kids who are going through the whole of their childhood. You know, you've got your first teeth, they all fall out, and you've got the second teeth, and sometimes they come up a bit crooked or a bit all over the place. You kind of need intervention there. You do. Forget about the Irish state taking care of you. There was a time, and I remember it. I remember a time way back a million years ago when I was a kid. You just go to the clinic and whatever you had to get. It wasn't a problem. This was when Ireland had no money. We were broke then. We weren't part of this nice big fancy schmancy EU empire where there's just loads of money floating about for everything. No, there was no money then, and we had better health care, better dental care. So something is going radically wrong. But I say good luck to the Greyhounds. I wish them well. I wish them well in their new lives after the racing track is over. And one thing is certain, at least if you adopt a greyhound, he's going to have one hell of a smile.